Hi everyone, thanks for having me today. You guys hear me back there? Good? Okay. So, like Dr. Ross said, years ago I was an undergraduate here at UCI. I studied biology, and while I was going through my undergrad, I was trying to figure out what I wanted to do. As an undergraduate in bio, we did the Bio 199. So I wanted to find a research opportunity, and looking at the research opportunities, I knew that bench work labs were not for me. I really wanted an opportunity to be more interactive with people, which was more clinical research. So in my search for a research laboratory, I found the MRAP program, which Dr. Loctefort was actually the director for, and that's how I met him. He became my mentor from the time I started in MRAP and until now. So I definitely kept in touch with him over the years, helped me get into grad school, and helped me get a job that I'm currently in right now. So lessons learned is keep in touch with your mentors throughout the years. They'll be so helpful for you, in the future. So I really encourage that. Take this time during the summer to get to know everyone that you're working with. You can establish great relationships with everyone for the summer and then for the future. So I definitely am thankful that I decided to maintain those relationships with my mentors. So through Dr. Loctefort, I actually met Dr. Agrin. I worked for her while I was going to school in her private practice, and Dr. Agrin is the founder and medical director of Clinic in the Park. So a little brief intro about the clinic. Our clinic is held once a month, and it's every second Sunday of the month, and at the Orange County Great Park Farmers Market. So they have a farmers market every Sunday, but we just are there adjacent to the farmers market on the second Sunday. And our clinics are from 10 a.m. to 2 p.m. All right, so this is Dr. Phyllis Agrin, our founder and medical director of our clinic, and she is Professor Emeritus of the Department of Pediatrics in UCI, and she has her private practice, pediatric GI office full-time, and she created this side project, Clinic in the Park. She started it in 2011, and we implemented our first clinic June of last year, 2012. So we actually just celebrated our first year anniversary. And Dr. Agrin's been involved in a lot of pediatric injury prevention research and programs. She used to be the past president of the American Academy of Pediatrics Orange County chapter, and she's still very much involved with them, and she does the injury prevention aspects of that. So I wanted to talk a little bit about public health in parks. There's been research that says, access to parks increases the frequency that you might exercise, and exposure to nature and greenery can, make you healthier. So Dr. Agrin kind of thought about incorporating parks with, health and wellness and more of the medical aspect of it. So the idea came about to, create a free clinic at the park so that we could promote health and wellness and have a park as part of our healthcare system. This is, a unique idea. We haven't heard about this anywhere else. So Dr. Agrin was very involved with Orange County Great Park because of her husband, Larry Agrin, who used to be the mayor of Irvine. and he kind of helped establish the Great Park. Have any of you guys been to the Great Park before? Yes? Okay, so it's the one, it's when you take the 5 South, exit Sand Canyon, and it used to be actually the old Air Force Base. And you'll see like a big orange balloon, and it goes up and you can see the old sites of Orange County. So Dr. Egan thought it'd be a great idea to incorporate the park with a clinic. Families can go on a Sunday, you know, they can make it a whole outing, enjoy the park, as well as get services. And also another aspect of it was most families, parents might have to work, you know, Monday through Friday or Monday through Saturday. So usually free clinics are open Monday through Friday working hours. So this would be a great opportunity for them to go to a free clinic on the weekend and actually bring their entire family with them and make it a whole day event. So our goals basically are just to sustain and expand our clinic. We want to connect people to medical homes and community resources. And we also want to make the park a venue for health. And our objectives are basically, we do enrollments for health insurance, we try to connect people to medical and dental homes, we do social services, and a few of our services, we do medical, dental, health screenings, health prevention skills, and then we provide, you know, access to resources. And a unique aspect of it is our health chats, which I'll talk about a little bit later, but health chats with doctors and other health professionals. So this is kind of an overview of our services at our clinic. So each bubble is the category and what type of services fall under that category. So as far as health screenings that we do body mass index measurements. We have a registered dietitian who's there who will do a nutrition assessment with you and consultation. We have speech and hearing screenings, asthma screenings. We have community health workers who are there who will help enroll people in health insurance through the 1E app. And we can refer them to medical and dental homes. We have Think Together, which is one of our collaborators who is there to promote early literacy, and they give out free books to children, and we'll do a little reading circle. So we have a variety of things. One of our main things is, because Dr. Agron is a pediatric doctor and she's really involved with injury prevention, we have our Keep Kids Safe station, and that focuses a lot on safe sleep, so SIDS prevention, and we do car seat fittings, we give out booster seats to families in need, we'll do bicycle safety, and we also give out bicycle helmets and do a fitting right there and then at the clinic. So as you can see, we have a variety of services that we provide monthly. And here's just a quick overview of what our clinic kind of looks like. We have, you know, our car seat station. Farmer Tom Larson is our farmer at the Great Park, and he runs the farm and food lab. So we've really tried to connect with them and encourage our families who visit the clinic to visit the farm and food lab to learn about growing their own vegetables and fruit. The Orange County Great Park has a farm there who's run by A.G. Karamura, and he actually donates produce each month to our clinic so that we can give it out to families in need, and we provide the produce as incentives for visiting our stations and so forth. So, a few stories that we had over the past year when we're encountering families is one of a family of 3 adults and 3 children, and they were less than 3 years old. And the mother came up to one of our volunteers and said that they were having trouble buckling their child in their car seat. And so we took them over to our Keep Kids safe station, and we decided, okay, let's take their height and their weight, and turned out that they were just too big for the current car seat that they were in, so that explained why they couldn't fit in. And so, they couldn't afford booster seats, so we gave them booster seats on the spot. And on top of that, the mother didn't have health insurance, so we had the Hurt Mobile Clinic there, and she got assessed and got her breast exam, flu shots, and was enrolled in medical care. So as you can see, it's just, families coming in, they have a variety of issues or problems and difficulty to access certain care. So we could actually do it on the spot and help out, everyone. So this is our little 3 kids who got their booster seats. And so they all got a booster seats, and we provide it free of charge. Just as long as, they're low income and they can't afford it on their own. We also have an occupational therapist at our clinic who will help assess your child's progress with their milestones. And she's actually part of West Coast University, and she does a wonderful job setting up all these activity stations to help assess their developmental stages. So here are just a few comments from our visitors. A lot of people don't have health insurance currently, so they're really grateful to come to our clinic and receive access to care. We also have our dental clinic, and they give out information about their dental services and oral screenings, and they give fluoride treatment as well. So with all these services that we're giving out, one tool that we devised to help track what our visitors are getting in terms of service is this passport to prizes. So on the front is just a little demographic information that they can fill out, and each of these squares are actually a service that they can get at the clinic. Not all services are there monthly, some rotate, but for the most part everything's there, and each station that they go to, they'll get a little sticker so we can help track what they're getting for that day. And at the end of the clinic, we encourage them to turn it in for an incentive, and this way we kind of track what services are the most popular, which tables they're really visiting. So 2012 to 2013, so in our first year of implementation, we actually had a total of 12,000 services, and Dr. Akron had established a goal to have 2,000 visitors in 1 year, and we definitely exceeded that. We had over 5,000 visitors. And this is just, so we started in June of last year, and our attendance was a little low, and it started getting higher and higher. And there's dips here and there just due to holidays. So in December, our visitor count was pretty low because of the holidays. And also we had a clinic on Mother's Day, which is, we just wanted to see what the outcome would be, but turns out that people don't really visit, the park on Mother's Day, so our attendance was pretty low in May. So this is kind of helpful for us to know, which months will we expect to have visitors, and so next year probably we won't do our Mother's Day clinic, so to so low. All right, and we like to associate what services we're giving out with our cost savings and benefit cost ratio. So for example, if we're giving a booster seat that just costs about $35, we're actually saving $2,600. And that's, medical cost, work loss, quality of life. So we're really trying to take that into account and not just saying, okay, we're giving a booster seat and that's that, they're safe. But this is actually the benefit cost ratio for it. And same thing with bicycle helmets. Also with our dental services, every dollar that we invest can save you up to $35 in dental costs. And so let me talk a little bit about our research. So we have our clinic, we're doing all these services, but the main thing that we wanted to keep track of was how is our clinic impacting our visitors, our community. Of course, we can just keep track of what we're doing, but how do we really know if we're really making an impact? And how do we know if our clinic in the park model is something viable, if it's something sustainable, and maybe even something we can replicate in other venues? So we actually wrote a grant with UCI, and it was a grant from ICTS, and we received that grant this year, and so we were able to get some funding to fund our research. And on top of that, we got public health research students. I was involved in a course at UCI that they had just developed last year. So I helped design and implement that course, and it was a course for public health students, and it was clinical and translational research preparatory program. So that preparatory program, there are public health students there who had no experience in research whatsoever, most of them for that matter. Pi was actually in that program, and so they were given a chance to learn about research, and then we gave them opportunities to rotate in different research groups, and I was able to get some research students for myself for clinic in the park so we could implement our research. And IM was decided to apply for SurfIT. So we got the opportunity to have IM with us for the summer and really focus on our research project. And a lot of what PIM's going to be working on is our needs assessment, and then we're also doing a pilot study. So with our needs assessment, we wanted to find out what services at our clinic were really useful to the visitors or what they were looking for. And we wanted to kind of also see what type of visitors we were getting. So demographically, income level, if they had any insurance. And a lot of it, before we had our little research team, I was doing a lot myself already, trying to analyze the data, trying to pull it and everything. But it really helps when you have all these other resources to collaborate with. So with UCI, partnering with them is great because we could use our resources like RedCap, and we could store our data on there. And with our statistician, Dr. Anderson, he could help us analyze our data and formulate our evaluation tools and our studies. So it really helped to just do this whole collaborative thing. And our pilot study is something else that we're going to work on. So we plan on piloting a study to follow about 50 families. And we're going to do a pre and post test, and then follow up with them a few months later after their first visit to the clinic. So we can just determine whether, whatever services they did get, how has it helped them or changed anything based on knowledge, behavior, were they able to get access to medical care, a medical home, dental home. So that's part of our research that we're planning to implement this year. We have over 30 collaborators who are part of our clinic, and they vary from academic institutions, other nonprofits. So you can see them all here. And this is our organization. We have a lot of different faculty involved, our advisory committee. Our fiscal sponsor is 10C. 10C used to be the volunteer center for the greater Orange County. And what they do is they kind of just provide the back services for us, human resources, help us with our grants and so forth. And we've gotten support from a lot of foundations so far. Angels Baseball Foundations, Ronald McDonald House Charities, Walmart, and Hogue. So if you want any more information, there's my contact information, and you can visit our website. And I want to show you a little video, so hopefully you can hear it. Maybe you're not going to be able to hear it. Okay, scratch that. So I can send you a copy of the video if you guys want to watch it. But generally, this is our clinic. So it's outdoors. We have all our organizations there. We actually recently granted an award to a Title I elementary school. Title I elementary school, and they were bused in to our clinic on Sunday, and so far they've come 3 months in a row, and these are low-income families, so children and their parents come to the clinic and receive our services, and they're really grateful for it, because otherwise they wouldn't be able to come to our clinics because they have no means of transportation. So we're trying to partner with more schools, more districts, hopefully in South Orange County as well. And we're doing bicycle helmet fittings. We have Healthy Smiles who's there. And that's it. So do you guys have any questions?
Is this over?
Yeah.
Thank you very much. Questions?